Hi, this is Teddy, and today you're listening to Dr. Dara Kass in New York City on Two Broads Talking Politics.
Are you listening?
Hi everyone, this is Kelly with Two Broads Talking Politics, part of the Demcast family of podcasts, and the other broad joining me today is Dr. Dara Kass, who is an emergency medicine physician in New York City. Hi, Dr. Kass.
Thank you for having me.
Yeah, thanks for joining me. So you are right on the front lines, right in the midst of everything that is happening right now. So first of all, thank you for being there and doing what you're doing. But also just sort of tell me a little bit, what's it like right now? How are things? Are things still ramping up, getting better? You know, what's it look like on the ground?
I think that the overall theme of what's happened over the past 2 months is really very surreal. I think that we started out seeing the patients in the background, really understanding what was happening with patients who were having respiratory symptoms, fevers, coughs, and really they were walking well. I do a lot of telemedicine as part of my job as an emergency medicine doctor, ironically, to give me more portability and flexibility in my job, work I did on some gender equity stuff and politics and stuff like that. And so in the beginning of this crisis, I saw a lot of patients at home who had respiratory viruses, who were super sick, but not sick enough to be seen by their doctor. And we all in the hospital, and we knew that we could really keep people out of the hospital responsibly by taking care of them at home. And then that pivoted to the in-hospital care, which was really an overwhelming surge of patients in New York City and other cities like ours that saw a lot of patients come in critically ill, needing oxygen support, needing ventilators, needing other resuscitation measures, and really watching our healthcare system get pushed to its limits. I mean, we were days, hours, even potentially away from hitting our resource utilization maximum in some of our hospitals in New York City. And then we've seen a lot of the work of the New Yorkers and other cities like ours work. I mean, we've seen the difference between California and New York and when they put in the measures for distancing versus when we did. We see what's happening in Chicago and which communities are being impacted disproportionately, with this virus. And we've been able to learn the lessons, I think, hopefully quickly in reacting in how we take care of patients and how we take care of each other. We're still in a critical moment, I think, in this virus and in this pandemic in understanding what resources we have available, not just medically, but also mentally for our citizens. So I think that that's the phase that we're in now. It's kind of 8 weeks in. I think we're all very exhausted for lots of reasons. Some of us have gotten sick and gotten better. I did have the coronavirus myself that I got probably from taking care of patients, although I'm a New Yorker, so I may have just gotten it on the streets. We don't know for sure. And that was an interesting and surreal experience itself, just being sick in this moment, being able to identify with my patients and having the same virus that they had, which was kind of crazy. And now we're looking at, it's May 1st right now, today, and we're looking at the next phase of this journey, which looks at experimental openings of certain cities and certain communities to re-engage themselves and then see what's working if we have enough testing and tracking to start understanding how we can gather again slowly, responsibly, and react appropriately to what that's going to do in our communities.
How much testing do we need in order to be able to, quote unquote, reopen, to be able to move back into something resembling what life used to look like before? And how far away from that amount of testing are we?
So I think that's a lot of questions looped into one, right? Which is that we are very far from what we used to have even 3 months ago. I mean, I spent the first couple of months, the last few months of last year and the first few weeks of this one, kind of on the campaign trail dealing with the primary season. And that was really super fun. And that's a far distant memory to me right now. The idea of getting on a plane, traveling to different cities, going to rallies and gatherings of people just seems crazy right now. So we're far from that. And I think we're not going to get back to that kind of normal until we have a broadly available, safe vaccine that will address this virus and really protect the people that are not going to be infected by it in the natural way. I think that how much testing we need is also a moving target. We need more than we have. That is a definitively safe answer than we could say right now. And a lot of that has to do with the approach, honestly, that the federal government has had to the responsibility of testing. Not to say that the federal government's responsible to execute tests on the local level, but it is responsible to figure out how to support communities, states, and federal governments, and state governments, on the acquisition of the products and honestly on the fixing of the pricing, and then make sure that the distribution is appropriate. And so we know that the products we needed to do the tests were not available on scale anywhere. And that's where the Defense Production Act comes in helping to try and see if we can produce those products to get together to get enough tests. We're doing about, depending on the day, between 100 to 200,000, maybe even 250,000 tests a day right now across the country. And the most conservative estimates, the smallest estimates, say we should probably be at about 500,000 tests a day. So we're at about a half of our bottommost estimate for that. So we need to at least double production of tests to consider ourselves testing at any level that's appropriate. And there are metrics that say we should go from somewhere between 500,000 tests a day to 5 million tests a day, and within that spectrum. And we have done barely 5 million tests since we started all of this 10 weeks ago. So if we've done 10 days worth of tests in 10 weeks, then we are probably really far from mission accomplished on any level regarding to testing.
So you started to get at this, but I think a lot of people think about testing from an individual basis. Makes sense. None of us who, are new to public health, which is most of us, ever thought about this before.
I'm an emergency medicine doctor.
Right. So, but what, everyone wants to know sort of, did I have it? Do I have it? But the individuals don't matter the individuals matter, but the individual testing doesn't matter as much, right? So what are we looking for when we say we need to test this many people?
Okay. So I actually think that we've lost a little bit of the forest for the trees in the testing, because I do think individual testing matters for other reasons that are not public health or certainly epidemiological. So just to give you a sense of that, if there are going to be a lot of Americans, specifically like in New York where I live, who were told they needed to isolate themselves from their family because they had presumed coronavirus, who are going to some now get either antibody tested, or if they're still in their course of disease, get PCR, which is the nasal swab tested, and find out they don't have it. And so there is going to be this kind of retroactive, honestly, trauma in the idea that you've survived this virus and now you're going to find out you didn't actually have it. And that really was a function, honestly, that trauma of us not having enough tests at the time. Because if we could have tested all those individuals in their communities when they got sick, we could have told them in real time, you don't have the coronavirus or you do have the coronavirus. I will also say that individually, if you have the coronavirus, this coronavirus, COVID-19, and you are sick, you do isolate yourself from your family differently than you do when you just think you might have it. So putting that away, I think that the picture of who's sick with coronavirus in your community, where is your community a hot spot? We use those terms a lot. How would we know that? So there's two kinds of tests out there that I think people need to understand, and they're being used differently, I think, in messaging around where we live. So if people think they've missed the boat on active infections, they're pushing antibody testing as somehow like a retrograde view of what happened in a community. If communities didn't have a lot of disease, they're talking about future testing to see if they could open and if they could engage communities again. But they're both really important. So if somebody has symptoms of a virus, now the coronavirus, and those would be muscle aches, fatigue, shortness of breath, cough, headaches, loss of taste, all those symptoms, they need to be able to be tested in real time. That means they need to know where to go. They need to be able to get there. They need to get the test, and somebody needs to pay for it. So all those things are really important, because just having 1 million tests that nobody can afford or get to isn't really the public health answer. So that's first of all. So you have to have the tests available to people in real time so they can know if they're sick. After somebody recovers from the virus, almost irrespective if they got tested in real time, you need to be able to figure out if they developed antibodies to that virus to know if they're at risk to get it again and how many people were sick even if you missed them the first time. That's where the antibody tests come in. There are two different versions of antibody tests. One is this finger stick antibody test, which is kind of like a pregnancy test. So it says, yes, you're pregnant, or no, you're pregnant. The dirty secret about pregnancy tests is you have to be enough pregnant to be positive on a pregnancy test. So you can have hormone levels that don't meet the threshold and find out the next day you're pregnant. These are people that always say, it was +1, -1, +1. What does it mean? It's usually because your hormone levels are at that exact border. The same thing is true probably for the antibodies. So there will be people who take this pregnancy antibody test, for lack of a better description, who don't see antibodies on that test, who may have some circulating antibodies. But just like being pregnant, that is not enough antibody to consider yourself having antibodies, and you should still consider yourselves unprotected. There's also a blood test that people can do. It's a little more specific. It's a little more sensitive. It's got a higher window of antibody knowledge. Those people can go to get a blood test. Those are obviously harder to get, more expensive to run, and harder to scale. And so that's why we have both. We still don't know if you have antibodies, if you have immunity. And that's one of the questions we'll be answering over the next few months as we get more and more people who have antibodies and we make sure they cannot get reinfected again. Does that answer your public health questions on testing and tracing?
Yes, I think so. I mean, testing at least. The tracing,
the tracing is another story. Yeah,
is a whole different story. So I think a lot of people, me included, are sort of terrified of the idea of going back out in the world. Right. So, I live in Chicago, which was not hit anywhere near as badly as New York City, but still there are a lot of cases here. And for the next month, I don't need to think about it. I'm not really allowed to go back out in the world, so that's fine. But there's a part of me that thinks, well, what happens after that? All of a sudden, they're going to say, it's okay, go back to work. And what do I do? So as someone who has survived this, who has seen people with this, what is the level of we should be cautious, we should be careful, but should we be terrified of ever resuming any part of our lives?
So I really don't want people to be terrified of anything because there's so much you could be terrified for. Let's kind of unpack it and put it away a little bit. So I am not afraid to go outside even a little bit because I know how to protect myself and my family. And I am encouraging my friends and family to go outside for short periods of time, especially as we experiment with gatherings in a really responsible and safe way. If your community does not have testing or tracking at all, meaning that they can't go to people that are positive and find out who they connected with to see if those people are positive as well, then that really does affect your ability to gather with other people, since the risk of transmission is specifically around getting in proximity of people, specifically within 6 feet of people. If you can go outside and you can stay with that, away from people from 6 feet, there is literally no reason not to go outside. So if you have a driveway, go out and sit in it every single day. And if you're going to run the risk of being near anybody, put on a mask. The thing about the fabric masks, the cloth masks, community masks, and I was one of the first people to call for the masks publicly. This was right after we were starting to see kind of states were questioning if they were opening or closing. We didn't really know what was happening across the board. In the beginning, we didn't have a lot of masks for doctors, right? The PPE, everyone's learned what PPE is now, right? The personal protective equipment. We had a risk of not enough protective equipment. And so there was a fear that if we said to community members, please wear a mask when you go outside, it was going to somehow steal that protection from doctors. The resolution to that is fabric masks. So if you wear fabric masks, cloth masks, you make them from t-shirts, and from some people make them from underwear, which is kind of gross. You get to protect yourself. And the more important thing for me, which goes back to the fear and anxiety about this, is you remember we're in a different time. My husband, when I was just getting better from being sick and I would go walk outside to the supermarket and we would go get, I was allowed to go outside again. And I was very bad at social distancing. I would pull my mask off and I would talk on the phone and all these things. And he would yell at me. He's very good at social distancing. I didn't know I married a social distancer, but he doesn't like people in his personal space generally. And he's very aware of where people are in proximity to him. And he watches all these people. And so I see people on the street in New York City on a cell phone with no mask. And I want to call the personal protection police, because they're doing everything wrong. They're spitting when they talk, they're spraying it everywhere, and they're not paying attention to their surroundings. So I guess my point to you is, when you come outside, and you will come outside, and you need to come outside, right? You need to go to the grocery store. We never closed New York City, ever. We just shut it down a little and suppressed our communications and our interactions. We kept our essential businesses open. I kept riding the subway with a mask on to go to work. And we really were, I think, as responsible as we can be, and the numbers are showing it. So I think there's a really good way, and these are a lot of opportunities to teach us how to engage with other people again.
Yeah, that's helpful. So I want to sort of expand on that with the idea of mental health. You said earlier that we don't have enough resources for mental health. I think that is for everybody, right? That's for survivors. That's for people who are currently sick. That is certainly for doctors and people in emergency medicine. You, of course, unfortunately lost a colleague recently from mental health issues. So, and you had to separate from your own children when this all started. So talk to me a little bit about what the mental health needs are and what we could be doing, what the government could be providing, what everyone could be doing to really make sure that we are providing for mental health needs.
Well, so I think that, this is a traumatic experience for America. Right? You have to look at it broad strokes. We have been robbed of our identity, robbed of our community, robbed of our economy, and also been told that we might die. That is like and it's chaotic and unexpected. So that is the perfect setup for us all to be traumatized. As you pare down into the people that are impacted by this, communities of color, vulnerable communities, frontline healthcare workers, single parents, all these communities of people that otherwise were just keeping it together, you're really doubling and tripling the impact on their lives. You have to add in this other thing, which we may see, which is that there may be actually a neurological component to recovery from this disease that may have contributed to a lot of the impacts we're seeing in survivors and in people who are otherwise affected by this disease. The way we can help that is telemedicine, ironically, the opportunity to connect but not in person is the perfect opportunity for psychiatry and psychology. So it would be making those resources available to every person out there, whether they are a frontline healthcare worker or not. The governor of New York today actually just called for all health insurance companies and providers to make it copay free to see a mental health provider. And I think there's going to be an opportunity to expand those services. Historically, under our previous healthcare administrations, and not just, across the board, we have undervalued and under-reimbursed mental health support and honestly, just social supports in general. And I think this is a really good chance for us to revisit that and say that your brain is part of your body, right? You have a stroke, you pay attention to it. But I think we also need to look at kind of the holistic human health. And again, we've been talking about this as part of addiction, and recovery as really being medical conditions that need to be treated as such. And I think the same thing is true for the post-traumatic experience that we're going to have from this disease across the board, specifically amongst, vulnerable communities and physician community or healthcare worker communities.
So you've been really outspoken throughout your career about women in medicine, women in emergency medicine. I'm hoping that we're not seeing a lot of harassment of women during this, although I'm sure that is happening. But what are we seeing? It seems like a lot of the articles and things, a lot of the people who are being focused on are the men in public health or the men in emergency medicine. What can we be doing to really raise the voices of women, of the experience of women physicians, of making sure that is something that we're doing while all of this is going on?
So that has actually been a focus of mine since this started. So as soon as, when I got sick, people started paying attention, and I'm a person who lives my life pretty much out loud, in general, it's where I'm comfortable. So I was very public about getting the infection and what it meant to me and my family, not living with my children and stuff like that. And so I got a lot of requests to do media. And part of my approach to this was that it's critically important that we open up the conversations around having this virus, recovering the healthcare workforce, especially when we're dealing with a lot of mixed messaging and honestly misinformation coming from trusted, supposedly, historically trusted sources. In that same way, one of my then kind of pay it forward mandates was to expand the voices that were out there, make sure that voices of physicians of color, make sure that voices of physicians of different generations, making sure that people in different cities, rural America is honestly significantly underrepresented for these things. Like, we forget that there are healthcare workers, physicians in rural America calling for their states to stay away, to keep their social distancing, to make sure that they are responsible on testing and, tracing. And those voices are muted by their leadership. And so getting those physicians and nurses out there saying, we're seeing what's happening on the ground in our city in, rural Nebraska or wherever it is. And we don't agree with our governors. We've seen physicians in Tennessee call action against their governor for not ever doing a stay-at-home order because they know that their hospitals are significantly overwhelmed. Or in Georgia, physicians in Atlanta saying, what you're saying is not happening here. And more importantly, if you want to open up, rural areas in northern Georgia, that's one thing. But in Atlanta, we're seeing something else. Don't do that. Be responsible even within our state. So I think that the goal is to amplify the voices of healthcare workers, physicians across the board, representing many different demographics. I think it's also part of the reason, honestly, that we're talking about the socioeconomic and the racial disparity that we're seeing in the patients that have coronavirus. It's because we have leaders who represent those communities that are having a voice, and because we have healthcare workers that represent those communities, that are members of those communities, and they're saying, hey, listen, it's affecting the neighborhood I grew up in differently than the neighborhood you grew up in, right? Why is it that 70% of the patients in Chicago who are getting this virus and becoming sick are Black and brown when that's not 70% of the population, right? And what does that mean for the historic healthcare disparities and inequities that they've faced over their entire lives that set them up to react differently to a virus that has varied effects on people, but doesn't actually look at the race, the color of your skin when it enters your body? But it does recognize the systemic inequities you've been facing when it attacks your blood vessels and you have hypertension because you've been, for a generation, there have been many factors that have contributed to that medical disease developing in your body that had nothing to do with the genes you were born with. Genes, Genes, not Gieana. You have to say that sometimes.
Right. So I want to be mindful of time because I know that you are a very busy person, and so am I these days.
Ignoring my children as much as I can because they're homeschooling downstairs.
Yeah, mine are in another room somewhere. But are there other things you would like to make sure we talk about, that we think about today, things that you would just want to make sure aren't forgotten in this conversation?
Yeah. The most important, I think, thing we need to be talking about right now is that, the healthcare community wants people to start engaging again amongst themselves. We want to see small gatherings occur safely. We don't want to do this large kind of swathed suppression that's keeping everyone locked in their houses. But yet we're the ones that are saying we need to have testing, we need to have tracing, we need to be responsible, because we know that what will happen if we aren't responsible is that our healthcare systems will get not just close to overwhelmed like they did last time, but they will be actually overwhelmed. And we will see more people die, and we will see the resources get strapped. And the reason we're trying to do this responsibly is not because we have, an interest in economic collapse or we want to keep people unemployed. It's because this is literally about life and death. And so partner with us. Listen on the ground, see what's happening in your community. And if your community is ready to start gathering again, help your community leaders do that and hold your politicians and your leaders accountable for the metrics and the data that will keep your citizens alive. That's my call to action.
Yes, that's so important. And I hope that people do listen. I was one of those people that in early February was worried about all this, but
yeah, I wasn't.
It took a long time for other people.
I remember, I'll just say, I was in Nevada at the caucuses, literally there. And a friend of mine from college texted me. She goes, so am I ordering everything from Fresh Direct? What am I doing? Am I clamping down? What's happening? And I was like, you're crazy. You gotta stop. I'm really busy right now. I got stuff to do. And I wasn't ready to see this. This is a huge change in our lives. I'm generally not an apocalypse girl, But at the same time, as soon as I started recognizing the warning signs from Italy and seeing their hospitals get overwhelmed and really seeing the patients and listening to my trusted voices, we pivoted so fast from life as we knew it to life as we know it now. And this is where we are.
it's going to take a while, you mentioned, until there's a vaccine and we go back to sort of life as we knew it completely. Do you have any sort of thoughts of what the next year or two might look like before we get a vaccine?
Yeah, the next year or two are going to be a series of successful and failed experiments, I think. And that's to me, that's the best way to look at it. It means that we're going to look at things like overnight camps and say probably not a good investment of resources, but things like maybe day camps or 1 week sessions for our kids that have been in the house and say, let's try that. You know, it may mean that we look at restaurants and say, let's see if we could open them at 25% and give small business loans to those owners to get through that period of time of social distancing. So I think that I look forward to the next year of really the American Creative Project. One of the other things I'm really excited about in a rebuild is a national service corps of tracers and trackers that can take a bunch of people that were either underemployed or unemployed, or maybe between education opportunities like in college, and give them either credit or loan forgiveness or some other national service kind of payment to be part of this huge workforce that we're going to have to build. I think the other thing is there's an ebb and flow here. A lot of the economy and a lot of the jobs that used to, even just as recently as 3 months ago, be obvious are going to be changed. And we have to look for those opportunities for the future and decide where those opportunities lie. And I think that that's going to come to how our leadership goes and where they can see those opportunities and invest in those opportunities and support people getting to them so that they have a sense of purpose in the middle of what is a really chaotic time.
All right, final question. How are you? Are you okay?
I am. I think that it's a daily question, actually. And I think that I have plenty of time in days that I'm not okay. I think that I had practiced resilience for a long time. And I think that that is a learned skill that is useful. My department is offering an opt-out psychiatric visit for every faculty member, and I'm taking them up on it because I think that you have to give yourself an opportunity to feel pain and sadness, even in the middle of all this. We have had a very hard week in my department and my family. It's been a lot, but it's natural. This is a really sad time. The identity we're losing, the people we're losing, it's hard. But I lean on my friends and family and the ones that are, around for me, and we'll get through this together. And for me, things like this podcast and the media, because it's about messaging and it's about communication and making sure that people have really accurate information, is honestly what keeps me going right now, because it's really a scary time for a lot of people.
Well, thank you. Thank you so much for everything you're doing on the front lines. And thank you for doing this kind of work, for doing the messaging work and talking to me today.
Thank you really a lot for having me. I've looked forward to being here for a long time. I didn't know this would be it, but I'll take it.
All right. Well, we'll have you back someday when it's a different conversation.
Something I'm a lot more comfortable talking about.
All right.
Thank you for listening to Two Broads Talking Politics, part of the Dimcast Podcast Network. Our theme song is called Are You Listening? Off of the album Elephant Shaped Trees by the band Immunuri, and we're using it with permission of the band. Our logo and other original artwork is by Matthew Weflin and was created for use by this podcast. You can contact us at twobroadstalkingpolitics@gmail.com or on Twitter or Facebook at Two Broads Talk. You can find all of our episodes at twobroadstalkingpolitics.com or anywhere podcasts are found.